Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a oncologist talking to a patient called Mrs. Daniels. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Daniels. Please, come in and make yourself comfortable. I understand you're here to discuss some recent test results and concerns about your liver health.
Yes, that's right. I've been feeling very tired lately, and I noticed some discomfort on my right side. My doctor ordered some tests, and they mentioned seeing something unusual in my liver.
I see. Well, I've reviewed the results, and I'd like to go over them with you in detail. The imaging tests show a lesion on your liver, which is concerning for liver cancer. I know this can be overwhelming to hear, so please feel free to ask questions as we go along.
Liver cancer? I didn't realize that could be a possibility. I'm in shock, to be honest.
That's completely understandable, Mrs. Daniels. Liver cancer, or hepatocellular carcinoma, can develop in the liver's cells. In some cases, it occurs in people who have risk factors like chronic liver disease or cirrhosis, but it can also develop without any previous liver issues.
I see. I don't think I have any history of liver disease, though. I mean, I do drink occasionally, but nothing excessive.
Right, and it's good to clarify that. While chronic alcohol use and hepatitis infections are some common risk factors, liver cancer can sometimes develop even without these. Other factors, like fatty liver disease or family history, can also play a role, but we don't always know why it appears in some people and not others.
That's a bit unsettling. So, what does this mean for me going forward?
Well, first, I want to reassure you that we'll develop a comprehensive plan to approach this. Typically, treatment options for liver cancer depend on the stage of the tumor, its size, location, and your overall health. At this point, we'll likely conduct a biopsy to confirm the diagnosis and stage the cancer.
A biopsy? How is that done for something like this?
A biopsy for liver cancer is usually performed with a fine needle guided by imaging, like an ultrasound or CT scan, to precisely target the area. The procedure is generally quick and can be done under local anesthesia, so you'll feel only minimal discomfort. Once we have a sample, we can confirm whether the cells are cancerous and get more details about the type of cancer.
And if it's confirmed as cancer, what would the treatment look like?
That's an important question. Treatment options for liver cancer can vary widely. In early stages, surgery might be possible to remove part of the liver where the tumor is located. There are also targeted therapies, immunotherapy, and sometimes chemotherapy, depending on the cancer's specific characteristics and stage. For some cases, liver transplantation may be considered if the cancer meets specific criteria.
Surgery sounds intense. How effective is it?
Surgery can be very effective in early-stage liver cancer cases. The liver is unique in that it can regenerate, so removing a portion doesn't usually affect liver function long-term. However, this option depends on many factors, including your overall health and the exact location of the tumor. If surgery isn't feasible, we have other strategies that can help manage and, in some cases, shrink the cancer.
I appreciate the explanation. This all feels like a lot to process. Are there lifestyle changes I need to consider right away?
Absolutely, and it's good to think about proactive steps. A liver-friendly diet low in fats and sugars, avoiding alcohol, and staying physically active can support your overall health. These changes are especially beneficial to reduce strain on the liver. Additionally, avoiding certain medications and supplements that may impact liver function is important, so always check with us before starting anything new.
That makes sense. I'd like to know if there's anything else I can do to help with treatment or prevention.
Yes, along with lifestyle changes, maintaining a strong support network is essential. Consider leaning on family, friends, or even support groups specifically for liver cancer patients. Psychological support can also make a significant difference in coping with a cancer diagnosis.
I'll keep that in mind. What should I expect in terms of monitoring or follow-up?
After the biopsy, and depending on our next steps, you'll have regular follow-up appointments with imaging, blood tests, and physical exams. This helps us monitor any changes, adjust treatments as needed, and ensure the best possible outcome. I'll work closely with you to make sure everything is manageable.
Thank you, Doctor. I feel a bit more prepared, but this is still very difficult to take in.
I completely understand. Please know that you're not alone in this. We'll walk through each step together, and I'm here to answer any questions you may have, no matter how big or small. Taking things one day at a time can make a big difference.
I appreciate that. I think I just need a little time to absorb everything.
Take all the time you need, Mrs. Daniels. And remember, support is always available here whenever you're ready. Just reach out, and we'll make sure you're informed and comfortable with each part of your care plan.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Dr. Wheeler. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Langston. I'm Dr. Wheeler, an infectious disease specialist. It's nice to meet you.
Hi, Dr. Wheeler. Nice to meet you too. So, I was told you'd be explaining a bit more about what's causing my symptoms.
Yes, I will. First, I'd like to go over some of your recent symptoms and medical history to make sure I have all the details. According to the report, you recently began experiencing headaches, fever, and muscle weakness after being bitten by a stray animal. Is that right?
Yes, that's right. It's been about a week since I was bitten by a dog while I was on vacation. I thought it was healing fine, but then these symptoms started, and I've also felt unusually anxious and restless.
I understand. It sounds like you've been through a lot, and it's good that you came in as soon as you noticed these symptoms. When you were bitten, did you receive any medical care or vaccinations for rabies?
No, I didn't get any shots or anything at the time. I thought it wasn't too serious. I just cleaned the wound and put a bandage on it.
I see. Unfortunately, some infections, like rabies, can progress even if the wound itself appears to heal. Rabies is a viral infection that affects the nervous system, and it's primarily transmitted through bites or scratches from infected animals. Symptoms typically begin mildly, but can progress rapidly if left untreated.
Oh, wow. So, do I actually have rabies?
Based on your symptoms and history, rabies is a strong possibility. Rabies infections are rare but can be fatal if untreated, especially once symptoms begin. We will run tests to confirm, but we need to act quickly. Early treatment is critical in managing rabies.
I had no idea it was that serious. What are the next steps?
First, we'll give you a series of rabies post-exposure prophylaxis PEP injections. These include both a rabies immunoglobulin and a rabies vaccine, which are designed to stimulate your immune system to fight the virus. The immunoglobulin provides immediate protection, while the vaccine will encourage your body to develop a longer-lasting immunity.
And will the shot stop the virus completely?
In most cases, if the treatment is given promptly, yes. However, because rabies can advance rapidly, the timing of treatment is crucial. Since you were bitten a week ago, we're on a tight timeline, but the vaccine series has been effective even when started later.
That sounds reassuring, but are there any risks or side effects?
Generally, the vaccine and immunoglobulin are safe, though you might experience mild side effects like soreness at the injection site, fever, or fatigue. Serious reactions are rare, but we'll monitor you closely for any signs of complications.
Okay, and what happens if I don't take the treatment? Is there any chance the virus will just go away on its own?
Unfortunately, no. Once rabies symptoms appear, the disease is almost always fatal if untreated. The virus targets the nervous system, leading to severe neurological symptoms, such as confusion, seizures, and eventually coma. This is why early intervention is critical, and rabies PEP is highly effective at stopping the virus before it reaches the central nervous system.
That sounds really scary. I definitely want to go ahead with the treatment then. Is there anything else I should know?
It's a good choice to start treatment as soon as possible. I also want to advise you on monitoring your symptoms and maintaining hydration. Rabies can sometimes cause anxiety and restlessness, but the medications we'll give should ease that over time. And in the future, if you're ever bitten by an animal, especially a wild or unvaccinated one, seek immediate medical attention, even if the wound looks minor.
Absolutely. I won't take any risks next time. And thank you for explaining all of this. It's a lot to take in, but I feel more at ease knowing what to expect.
You're welcome, Mr. Langston. I'm here to support you through the process. We'll get the first injection started now and schedule the rest over the next few weeks. I'll also have the nurse provide some resources on rabies prevention and what to do if you encounter wildlife again in the future.
I appreciate that, Doctor. Thank you for helping me understand what's going on.
Of course. I'll check in with you regularly as we go through the treatment. You're in good hands, Mr. Langston, and we'll work together to make sure you stay healthy and safe.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear part of a training on applying evidence-based practice in nursing. Now read the question.
Today, I am here to introduce a new focus for our nursing staff that will enhance our clinical decision-making process. This focus is on evidence-based practice, which integrates the best available research with clinical expertise and patient values. Our goal is for nurses to utilize evidence-based practice to improve patient outcomes, making our approach both more effective and reliable. By adopting evidence-based practices, we aim to reduce variability in care, making it easier for nurses to make informed choices and for patients to receive consistent, high-quality care. We believe that this approach will lead to increased satisfaction among patients and a stronger foundation for nurses in their day-to-day decision-making.
Now look at question 26. You hear a doctor's discussion with a nurse. Now read the question.
It's a real issue because she seems unaware of the full extent of her condition. She only mentioned taking a small red pill at night, but nothing more specific. She seemed to understand when I explained the importance of the surgery, but
Who knows if she actually processed that information or if she'll even remember it once she's stabilized? Do you think her neighbor, who accompanied her here, might help?
I doubt it. He seems concerned and willing to stay, but is just as unaware of her medical history. Honestly, I think we should keep trying to reach her husband for consent.
Now look at question 27. You hear a doctor sharing his view on handovers. Now read the question.
Thank you for giving me the opportunity to share this. When it comes to handovers, providing significant lab results and pending tests is essential to ensure the next shift has the critical information needed for patient care. The process should include relevant lab results and current diagnostics without diving into an overwhelming level of detail. For example, when discussing a patient's condition, it's not necessary to list every lab value from the past week. Instead, focus on key results that directly impact the patient's current treatment plan. Take this case: a patient admitted with severe abdominal pain had an elevated white blood cell count and an urgent CT scan, which is pending. Mentioning that the patient had these results and why the CT scan is significant helps prioritize the handover. The goal is to give an overview that highlights what's most relevant to the patient's condition and the decisions to be made in the near future. Now, as you convey these points, it's important to include any significant trends in lab results, but only if they are pertinent.
Now look at question 28. You hear a surgeon discussing a patient with a nurse in the recovery ward. Now, read the question.
It looks like Mrs. Carter is recovering well after her mastectomy. Will she be going up to the ward shortly?
Yes, I'll arrange for a porter. She should be heading up in about 15 minutes.
Good. I've added a few post-op follow-up notes. It's important we monitor her for any signs of lymphedema. With lymph nodes involved in the procedure, there's always a chance of fluid retention in her arm. We also need to keep an eye on the surgical site for any signs of infection, redness, heat, or discharge. Additionally, don't forget to provide her with resources for emotional support. This can be a tough recovery process mentally as well as physically.
Understood. I'll ensure all these details are passed on to the next shift.
Perfect. If anything comes up or you have any concerns, let me know.
Now look at question 29. You hear a nutritionist talking to a patient. Now read the question. So, what brings you in today?
I'm struggling with digestion issues and feel like I'm always uncomfortable. I know I should be eating more fiber, but I just can't seem to manage it. Maybe fiber just isn't that important?
Well, I'm glad you came to talk about this. Actually, fiber is a crucial part of a healthy diet, especially for digestive health. Many people don't realize that fiber isn't just one thing. It's made up of two main types, soluble and insoluble fiber, and each plays an important role.
Thanks, but I don't know if it's worth all the effort to get more fiber if it doesn't really make a difference.
I understand that, but it's important to know that dietary fiber is essential. Soluble fiber absorbs water and helps soften stools, making digestion easier, while insoluble fiber adds bulk and keeps everything moving. Together, they help maintain a balanced gut and prevent issues like constipation, and even reduce risks of certain diseases. When you lack fiber, your digestive system has to work harder, and that can lead to more discomfort. Now look at question 30. You hear a conversation between a medical ethicist and a healthcare provider, discussing the role of religious therapists in patient care. Now read the question.
Spent the past hour reviewing various case studies where patients have requested religious support as part of their treatment plans. I'm trying to determine under what circumstances it's truly beneficial to bring in a religious therapist as opposed to sticking strictly with conventional healthcare providers.
That's an interesting angle. Let me know if I can offer some insights there. I mean, we're already seeing a growing need to accommodate diverse spiritual needs in clinical settings, and it's not always easy to strike a balance between traditional care and spiritual considerations.
Yes, it's definitely a complex balance. Every day, it feels like we're juggling patient needs, ethical principles, and the limitations of our resources.
Absolutely. I have quite a few administrative duties as well, and finding time to integrate religious elements into treatment is often challenging. I do wish there was a clearer process for involving religious therapists in ways that fit within our medical protocols, but
that is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Sarah Lane. You now have 90 seconds to read questions.
I'm joined today by Dr. Sarah Lane, a neurologist who specializes in treating patients with multiple sclerosis called MS. Now, MS is a progressive condition that can have an enormous impact on day-to-day life. Dr. Lane, what are some of the biggest challenges people face as their MS symptoms progress?
Well, MS affects each individual differently, but common symptoms include muscle weakness, fatigue, and issues with coordination. For many patients, the unpredictable nature of MS is the hardest part. For instance, one of my patients, let's call her Emily, told me that she never knows if a day will be good or bad. She might have plans, but then find herself unable to move around or manage basic tasks because of a sudden flare-up. And while some patients come to terms with the physical limitations, it's often the emotional burden that can be overwhelming.
And managing these symptoms must require considerable adjustments. What do you typically suggest for patients who want to maintain some independence?
Maintaining independence is a huge goal for many people living with MS. Fatigue is often the most disabling symptom, so I encourage patients to conserve their energy by prioritizing tasks and taking frequent rest breaks. It also helps to organize daily activities strategically, for instance, completing more demanding tasks when they feel most energized. Assistive devices can also be life-changing. Some patients may use a cane, walker, or other aids to help with mobility and avoid accidents.
And does exercise play a role in managing the symptoms of MS?
Absolutely. While exercise doesn't prevent MS, it can be immensely beneficial in managing its symptoms. Many people with MS find that low-impact exercises like yoga, swimming, or Tai Chi help maintain muscle strength and flexibility. One study I was involved in showed that regular tailored exercise actually improves energy levels and reduces fatigue. But the key is to pace oneself. Overdoing it can lead to even more fatigue. So I advise patients to listen to their bodies and adjust accordingly.
Now, I understand that medication can help manage symptoms too. Could you explain how these treatments work?
Of course. MS medications generally fall into three categories. First, disease-modifying therapies, or DMTs, aim to slow down the progression of MS. These can be really effective, especially when started early. Then we have symptom management medications, which help relieve specific issues like muscle spasms, pain, or bladder problems. Finally, there are medications for managing relapses. For instance, corticosteroids can shorten the duration of a relapse, but won't affect the overall progression of the disease.
And there have been some exciting advancements in MS treatment lately, haven't there?
Yes, there have. One of the most promising areas of research right now is stem cell therapy, which aims to repair damage to the nervous system caused by MS. Clinical trials are still ongoing, but preliminary results are encouraging. Patients who've tried it report some improvements in mobility and even a reduction in relapses. Another exciting area is neuromodulation, which involves using electrical stimulation to help reduce symptoms. However, these treatments are still in experimental stages and aren't widely available just yet.
Do you have any final advice for people living with MS or for their families and caregivers?
I'd say that having a good support system is essential. MS is challenging not only for those diagnosed, but for their loved ones too. Finding ways to adapt together and maintain open communication makes a world of difference. And for people living with MS, it's important to stay informed about new therapies and maintain a positive outlook. The advancements we're seeing in research are giving patients real hope for the future.
Extract 2. Questions 37 to 42. You hear Dr. Nolan Spencer talking about a chronic skin condition called rosacea. Now, read the questions. You now have 90 seconds to read questions.
Hello, my name's Dr. Nolan Spencer. I'm a dermatologist, and today I'll be talking about a chronic skin condition called rosacea. Rosacea is quite common, though it's often misunderstood. It primarily affects the face and is characterized by redness, visible blood vessels, and in some cases, acne-like bumps. These symptoms tend to flare up for weeks or even months, and then subside for a time before potentially flaring up again. Rosacea can have a significant impact on self-esteem and confidence, as it alters the facial appearance, which can be distressing for patients. One of the complexities of treating rosacea is that it can be mistaken for other skin conditions, such as acne or even eczema. This confusion often delays proper diagnosis and, consequently, effective treatment. Patients usually report feeling frustrated by the repeated redness and flare-ups, which can sometimes be painful or even stinging. It's worth noting that while rosacea affects people of all skin types, those with fair skin, particularly individuals of Northern European descent, seem to be more prone to it. The exact cause of rosacea remains unknown, but we believe it is a result of an overactive immune response. Unlike other inflammatory skin conditions, rosacea doesn't appear to be caused by bacteria, but rather, it involves an intricate interplay between genetics and environmental factors. One key aspect of managing rosacea is identifying and avoiding triggers that exacerbate symptoms. Common triggers include exposure to sunlight, emotional stress, hot or cold weather, spicy foods, and even certain beverages, especially hot drinks or alcohol. Interestingly, patients often have varying triggers, so it can take time to identify the specific factors for each individual. Let me give an example. I once treated a 34-year-old man named Mark, who came in because he was experiencing constant redness and occasional swelling around his nose and cheeks. He had tried multiple over-the-counter treatments, assuming he had acne, but none provided lasting relief. When we discussed his lifestyle, he mentioned he enjoyed outdoor sports and was frequently exposed to direct sunlight, which is a common trigger for rosacea. After making a few lifestyle adjustments, such as using sunscreen with a high SPF and limiting his time in the sun, along with starting a prescribed topical treatment, his symptoms improved significantly. Treatment for rosacea varies depending on its severity. In mild cases, topical treatments, such as metronidazole or azelaic acid, are typically prescribed to help reduce inflammation and redness. For patients with more moderate to severe symptoms, oral medications like doxycycline may be used. Laser and light-based therapies can also be effective in reducing visible blood vessels. However, it's important to understand that while these treatments can help manage symptoms, they don't cure rosacea. Patients must continue to avoid their triggers, and they need to recognize that treatment is more about control than elimination. In another case, I had a 42-year-old woman named Lisa who had been struggling with rosacea for years. She described the constant flushing of her face as embarrassing and reported avoiding social gatherings out of self-consciousness. This is common among people with rosacea, as the condition has been linked to higher rates of anxiety and depression. I worked with Lisa to develop a comprehensive treatment plan that included a mild cleanser and a topical cream, along with behavioral changes to manage stress, another known trigger. Her condition improved over time, though it required persistence and patience. Dietary factors can also play a role in rosacea management. For some patients, foods that raise body temperature, like hot soups, spicy dishes, and alcohol, can trigger flare-ups. Additionally, avoiding foods high in histamine, like fermented products, may help minimize symptoms. That said, dietary changes alone won't eliminate rosacea, but they can be a helpful part of an overall management strategy. For example, a small study suggested that people with rosacea who avoid triggers such as alcohol and spicy foods see a noticeable reduction in flare-ups. Ultimately, we must consider the chronic nature of rosacea. Even with effective treatments and lifestyle adjustments, patients should understand that flare-ups may still occur periodically. Working closely with a healthcare provider to adjust treatments as needed can make a meaningful difference in the quality of life for those living with this condition.
That is the end of Part C. You now have 2 minutes to check your answers.